Fantastic, fantastic. And sitting next to Deputy Mayor Parenti, I'll say that, sitting next to, because why not? You know, we are together, is another city leader, Deputy Mayor Mike Fong from Seattle, Washington.
Morning. Thank you for having us.
Fantastic. Now, for those that are here, we're going to divide it up into basically 3 different sections. We are going to start with solutions and get right into it. Then we're going to get into some of the opportunities, mistakes, and, you know, because as we all live through this, me as a journalist and a news anchor, I have been able to speak with many leaders throughout the United States and internationally. So we are going to focus on the great solutions here, but on the ground. And then we'll move into some of the mistakes and opportunities. Finally, we're going to think about reimagining. What is next in these fine cities? And then finally, we'll get to questions and answers. And whether it's Twitter, YouTube, or through whatever mechanism you'd like, please, of course, give us your questions and we will get to those at the end of the conversation. So let's start with you, if I may, Madam Deputy Mayor. What would you say if you, and because I'm a journalist, I have to ask it this way, Deputy Mayor Sargadoui, is in a headline, where are you at right now? If I had to put it on a magazine, and I'll ask the other deputy mayors as well.
I would say, if I had to define that in a word, I would say that we are starting to see the light.
Starting to see the light is the headline there. Great, thank you so much, Deputy Mayor Sargadoui. Okay, Deputy Mayor Parenti, what's your headline?
Right. In Torino, the number of cases is still growing, unfortunately. So we didn't see light yet, but we try to face a new policy on the territory because the curve is beginning to flatten. So we want to define how to the exit strategy for what we call the phase 2. At the end of the first phase, we try to reconnect the dot that we have lost.
Thank you so much. Let's go now to Deputy Mayor Fong. Mr. Deputy Mayor, how would you characterize your headline?
Well, Richard, I would hope our headline would be that facts and science are driving decision-making in Seattle, and that while we are bending the curve, we haven't flattened it, and we are proceeding cautiously with the help of everyone in our community.
Of course, if you let me say that, of course, I could say that it's also true that we have learned from this crisis that things can go so fast, much faster than our society. And we thought that our modern society was used to a very quick, movement. But it has been proved that we were not ready to be so quick. And that even if we have tried to give a very fast response to what is happening, we haven't been able to even advertise which is going to be happening and how things change from hour to hour. It's not talking about years, it's not talking about months, it's not even talking about days, it's talking about hours.
Hours. To the other.
Sorry,
Yeah,
I agree. The real problem is what we call the time to market for the emergency. The timing is our problem, because the public administration is not ready to face very quickly a very agile way to respond to the emergency. That's the real problem.
Deputy Mayor Fong, talk about timing.
Sure, and to dovetail off of both Deputy Mayor's comments, I think early on, people kept advising us that, bear in mind, this is going to be a marathon, not a sprint. And I think the truth is it's a little bit of both. I mean, right out of the gate since late January, when we had our first confirmed COVID case in the Seattle region, a little bit short of a month later, we had our first confirmed death. And by the end of February, we've already declared a state of emergency at all levels of government. And since then, it's been, as the deputy mayors have mentioned, at times an hour-by-hour decision-making process in order to stay, while we're trying to bend this curve, we try to stay ahead of it. And that involves both in terms of disease suppression with regard to the pandemic itself, but at the same time meeting a whole host of community needs that have emerged as a result of implementing such a range of social distancing measures and mitigation measures in order to try to do everything we can to bring down the transmission of COVID-19. And where we are now is that we've had 60 days of very aggressive, united action from state, local, and city government. But while we're seeing that that curve is bending, what we now are facing is a sustainability question. I mean, to what extent can we both maintain a level of disease suppression while starting to bring back and ease up on social distancing measures? And all the modeling we have and some sidebar conversations I had with the deputy mayors earlier is that we're all concerned about a potential bounce back effect. And we need to be approaching our ability to bring elements of society back online with a degree of caution, while at the same time making sure we have the infrastructure in place to maintain a level of disease suppression. So that's sort of where we are at this point in time, but with a series of very difficult questions in front of us.
Deputy Mayor Sagardui, I was looking at the data coming out of Spain, and of course the United States having the largest number of cases at this moment. And unfortunately, the gathering today is of those countries that now represent the top countries in the world that have cases. If you were to write the guidebook, Deputy Mayor Sagardui, what would the one lesson you would put in there for other deputy mayors in terms of combating this? The solution you would put in that guidebook, what would it be?
Well, first of all, what I would say is that's something that you have to have done previously, and that's the health system. I want to claim for all those workers and for all those health systems that are helping us to affront this pandemic. I have to tell that I'm very, very sure that if the Basque Country wouldn't have the public health system that we have, and if we hadn't worked together with the private sector of the city, which is also very important in terms of health system, things should be different, absolutely different. That's my first point. A second one should be coordination. I think that the fact that we were even 2 weeks before the pandemic was known here in Bilbao, right in our city, we already were looking what was happening abroad. We were looking very closely how China was developing, how Italy was developing, and also trying to learn from those measures that they were installing. There is also very important for me coordination among not only among the different departments of the town hall, but also with the other administrations and private sectors of the city. We have been working together with the provincial government of Biscay, but especially with the Basque government here in our country. And fourth, it's also to be very practical. As I told you 2 weeks before, we were thinking about what should we do if this comes to Bilbao. So we had already planned social measures. For instance, we were very, very impressed about how things were happening in some of the cities that were behind us in suffering the pandemic. And we tried to take care of all those people who were in our streets, no? Mm-hmm. Also because most of us, for sure, we are in our houses and we've got many comfortable spaces and family help. But there are so many people in our cities, and we know that because that happens in every city in the world, who are very dependent from those public helps in order to take care of themselves. And that's something that we are started to think about very early. Second thing was also to be always in touch with the health system, so that we had scientific and data data of how was the pandemic, how was the illness affecting the population. And that's why we were very, very worried about elderly people in our city. Even if one of the first measures that we took was to close down all the schools in our city, it is true, and we have proved that those people who react worst to this pandemic are being those who are the elderly people, the elderly population. Here in Bilbao, we've got a very important elderly population. That's why our main measures have always been thinking about them also. Not only because those things that they may need in order to respect the lockdown, but also because loneliness is something that is being very important during this pandemic. I think that those kind of things have to be very seriously taken into account.
Thank you. That's the view from Bilbao. Let's go to Torino. Deputy Mayor, what is the lesson that you would put in the guidebook that will help other city leaders now that you've lived up to this point in Torino battling COVID-19? And I think you're still muted. I think you're still muted, Deputy Mayor Peronti.
Yeah.
Yes.
There you go.
Sorry. The first lesson is to consider not only the healthy impact and economic impact, but also the psychological and the social impacts. We have a lot of problems for our people, our citizens, for our children and other people. We start from closing the schools and the residence for elderly people because the subject more vulnerable for this emergency. So we starting from that point, but we work a lot with a lot of association of healthcare workers specialized in psychological health to support individuals and family in this very difficult phase. That's the one of first and the principal lesson learned, to don't underestimate the psychological and the social impacts of this emergency.
And what's the solution then, Deputy Mayor Peronti, to combat that? What would the lesson be that you would say to other deputy mayors, this is what you should do to offset the concern about, again, you're talking about the social as well as psychological effects?
We, for example, we set up a virtual support for a psychological institution for free.
Is it the phone? You'd call a phone number, is it?
Also with a sort of webinar in a group involving system or one-to-one colloquium to support, in particular, the family in the entire consider of the economical system. So the relationship between the children and parents and the grandparents for Italian culture is is a huge problem to break the relationship between grandchildren and grandparents. That was a very important problem. For example, we arrange a physical web call system by Cisco, for example, in each residence of elderly people.
Oh, wow.
Very important. We have a very important project for us with Cisco. In this case, over 30 residences have the Cisco system for virtual colloquium with the family.
Great idea, great idea. Deputy Mayor Fong, what's one of the lessons that you could, I mean, if we're sitting down next to each other, as we all are, the four of us, hey, this is what you got to do. This is a good idea. Do this.
Well, a couple things. First of all, both an observation and a lesson is the need for just widespread testing capacity has just been a continuous challenge. I think not just for our community, but communities across the United States. And the ability to really be able to have widespread testing capacity has been key in order to be able to do any sort of productive and effective containment of disease spread. And as such, given the lack of testing capacity, I think it's really important for communities to focus in then on what testing capacity you do have to be deploying that resource as strategically as possible. And
on that note, then, Deputy Mayor Fong, let's say you do have this beauty of hindsight. All three of you do as deputy mayors. How do you get the tests in place? Do you put them in a warehouse? Be ready for this? Is that what you're saying?
Well, and we have many thoughts about this, and I'm sure the other deputy mayors do as well. But a couple of things from our perspective. Number one is that, at least in the United States, to some extent, and Mayor Durkin has mentioned this before previously, is that over the last 60 days, securing testing and testing capacity supplies has become a little bit of a game of Hunger Games. And that just simply isn't the best way to approach a supply chain problem that is really facing every major city and rural area across the country, which is why we have been sort of focused on our advocacy so much on the need for a national federal approach to be able to initiate the kind of production necessary in order to get the supplies we need in order to do testing. I mean, part of our challenge isn't really even lab capacity. It's literally the swabs and the testing kits, which have been slow to materialize all across the country.
So what do you tell other deputy mayors? Let's say I'm in South Dakota right now. I'm thinking, okay, I've got a city to watch here, and I'm asking the three of you, what do I do if I want to get testing capacity in place in case I do have a surge? What would your quick answer to that be, Deputy Mayor Fong?
Well, I don't have a quick answer for the supply side problem, but on the prioritization and strategic side, I'd suggest, given limited supply, the need to have clear prioritization around how to best approach testing is key. And for us, in our community, that would be a combination of focusing in on long-term care facilities and the senior population and nursing homes, where we both saw where our first major outbreak was initiated, but at the same time, where we see congregate living settings being a challenge and a vulnerable population. And then second, our unsheltered homeless population. I mean, these are the areas where we have potential risk for broader, wide-scale outbreaks. And given limitations on testing, we really want to be strategic in how to deploy that resource.
Deputy Mayor Sargadui, before you get in on this, and I know that you have a thought on this, give me another solution in 60 seconds to tell other city leaders. You've given me one, and all of you have. Give me one more, and of course, I think you want to also respond to Deputy Mayor Fong. But I want another solution from you in 60 seconds, though, because we don't have a lot of time.
Leadership and communication. We started with one phone, which was 010, for all the worries of the population of Bilbao. There was no need of calling anywhere else. Whatever.
010.
Yes, 010. That's the phone that we still are using for all the population of Bilbao. Whatever they are worried about, they can call us there, and then we will be in charge of trying to give them the correct answer about that.
How many calls did you get on 010?
Yes, 010, that's fine. During the first days, it was very hard to try to answer all of them. We had to make a special group of a team of our people in order to answer all of them. It is true to say that, funny to say, I would say, even in this situation, that we were waiting during the first days for many social questions, for many medical questions, for many economical questions. And really, what people in the city of Bilbao was worried about was about taxes. Because we had...
Taxes?
Yes, Because many people were supposed to pay for the taxes, to the municipal taxes during the months of March and April. So we received maybe 7,000 questions about what's going to happen with my bills? What are you going to do with my taxes? Because I can't approach the town hall. So how am I going to do that, to pay that? So it was very important for the people first to say, please, first things go first. That's your health. That's the lockdown. And then we will be talking about all this. Don't worry, because we are not taking dates into account. So we will have time enough when everything passes. But what people have thanked us a lot is that they are not having to think, who do I call to ask about this?
Got it. Perfect.
Me in Bilbao, there is only one telephone number, and then we deal with the different issues that they may have.
010 is one of the solutions. Okay, Deputy Mayor in Bilbao. Deputy Mayor Peronti, give me another 60-second solution that you would like to tell other deputy mayors.
Yes, my suggestion is just a little bit different. The strength of ecosystem. Before this emergency, we have a platform that we call Torino City Lab as laboratory for innovation. We move quickly from Torino City Lab to Torino City Love to acquire all effort from public and private institutions, practitioners, citizens, startups, to create a very quickly project that to match very specific needs. In just 1 month, we create more than 18 projects, specific projects, from IT support, from tangible or intangible support. So my suggestion, I'm very confident about that, is the strength of ecosystem, the innovation ecosystem that can help all of us and the public administration to face this emergency.
Deputy Mayor Peronti, what do you have maybe a flyer or something, or can you show me something that represents one of the campaigns or communications that you have been doing in your great town of Turin, in Torino? Do you have something you can show me on camera?
A website. I can give you the website with all this project, or the description of this project for our citizens in this emergency.
Very good. Very good. So on the website. Deputy Mayor Fong, 60-second solution that you would like to share with another deputy mayor, wherever they might be in the world.
Sure. So one thing I and we learned as the last 60 days have unfolded is that there is and back to my earlier comment about the lack of widespread testing in the community, Mayor Durkin knew very early on that the only tool we had in the toolkit then to turn to would be the range of implementation around non-pharmaceutical interventions, or what we've referred to as social distancing measures and community mitigation measures. And that playbook is pretty tight. I mean, it outlines very specific grade level actions as you move up the continuum of strategies to be able to mitigate the spread of disease. However, that playbook, while prescriptive as far as from a meta level in terms of how you move from minimizing public gatherings to potential essential businesses, what it isn't as prescriptive on is how do you operationalize these things and make policy around how this at a wide scale, city scale level, how do you implement it? And that planning on the health advice side of the equation and the operational side, I think really needs to happen concurrently. And the lessons learned as we move through the continued ratcheting up of actions is informative as where we're at now in terms of how we reverse engineer this thing on the other end. At the same time, it's not as simple as just carrying out the same steps in the same manner as you did when we wound things down, because new care and consideration needs to be given in terms of the new normal, given the fact that we're months and months away from vaccination. We don't have widespread antibody testing. All these challenges mean that the same kind of operational care needs to go into thinking about how do these health-related decisions, which are entirely advisable, can actually be executed around impacts to community.
I want to move to the second section of our conversation today, and that is, look, it's a tough time. We are talking about hotspot cities, and not every decision, not everything is done perfectly, and we accept that because we're in the middle of a storm, right? The second section of our conversation, and I'll go to you, Deputy Mayor Sargadui in Bilbao. What was, in 60 seconds, one of the most difficult mistakes that you now, when you look back, that you could describe to us? And in that, what did you do very quickly?
I think that the worst thing we should have done was to do nothing. I think that even with the mistakes that for sure we have done, and especially more than mistakes, I think better done things, I would like to talk about that, things had to be done. And we couldn't lose too much time. I think that maybe trying to think about a future situation of an advice around this, I could say that I should have insisted even more on the recommendations of the health system and more about coordination among public administrations and private sector.
Very good. Thank you. Deputy Mayor Peronti, 60 seconds, the mistake that you remember the most and what you would suggest.
Yes. In Italy, we have three decision-making level: the national level, the regional level, and the city level. The city is the front end to the real need, but we decide very little. So the principal mistake is the lack of coordination, top down, but also bottom up, because we in the city, we know well the real need of our citizens. That's the real mistake. I don't have the solution, but I know very well the problem.
And this is why we appreciate all three of you deputy mayors being here, because we know this is where, as we say in the United States, where the rubber hits the road, right? This is where things happen. You have to manage it. You are the city leaders. Deputy Mayor Fong, what is your 60-second mistake and what happened after?
Yeah, Richard, I would say that, and again, it probably more falls in the line of continued lessons learned here, is that, and it touches on my earlier point about operationalizing some of the social distancing measures that we've been moving through. I mean, one of the more difficult and challenging conversations we had revolved around the question of maintaining capacity and opening our park system. And we grappled with this decision quite a bit, and it speaks to the point that both deputy mayors have also mentioned in terms of the pace of decision making that's happening under these circumstances. And with the fact that we had a good understanding of what we were trying to accomplish in terms of minimizing face-to-face contact and interactions of people in the public, the truth is that pandemic response is almost entirely reliant on voluntary compliance. I mean, there at least in a democratic society, we are heavily dependent on the fact that the trust of the public places and government, as far as advancing the best measures in the interest of public health, while at the same time for people to, well, frankly, the challenges of stay-at-home orders and others of the psychological impact and the need for just that interaction and getting outside. And we just grappled with the decision around parks for quite some time. At one point, we decided that given the Easter holiday coming upon us, we actually decided to close a number of major regional parks in the region, and then we opened them back up. And I think while it ultimately, I think we got into a reasonably good rhythm in terms of how to manage social distancing in public spaces such as our park system. It took a lot longer than we would have liked, and you know, we want to be consistent about it, and probably could have been more better prepared for how we're going to approach that issue.
Short answers if you can, my friends, deputy mayors, all three. What number do you watch day to day? What is the key number that you're watching as deputy mayor? Deputy Mayor Sargadoui.
What number I'm watching? There are so many numbers that I am watching these days that it's not easy to decide about that. But maybe those of the people who have been ill, who have died during every day in our city or in our province, and also those people who are getting recovered, because not only about talking about how many people are getting with the illness, but also how many people are getting recovered. That gives us a measure of how is developing the pandemic.
Got it. Deputy Mayor Peronti, what's the number you're watching? Oh, you're still muted, Deputy Mayor Peronti. There you go.
Yeah, we are watching with a very huge attention to what we call asymptomatic people. That's a real problem because that's is an unknown test to understand how we move to phase 2. That's the real problem that we are facing.
Perfect. By the way, we're going to get to Q&A in about 5 minutes. And those folks who would like to ask a question, please go ahead and do so in the Q&A section. And we already have some in there. Thank you. I'm watching them during our conversation. 60 seconds, Deputy Mayor Fong. What's the one number you're watching?
Well, like Deputy Mayor Segardi, we're watching so many numbers, probably hard to pinpoint just one, but Mayor Durkin holds a sub-cabinet meeting every morning, a COVID sub-cabinet meeting, and we always start with the number of confirmed cases in our community and the number of deaths. And I think that is probably the most basic metric that we're all tracking in terms of the dynamics in our community. At the same time, we're tracking a number of things, as both everything from our own workforce telecommuting patterns to first responders and the number of emergent cases among police and fire, and also unemployment insurance claims on a weekly basis in the city. I mean, we're looking at an entire range of a dashboard of indicators to give us a sense of where our community stands right now in this crisis.
Deputy Mayor Peronti, how many hours a day do you work? How many hours a week do you work? How about that? Just give me the number.
23 a day.
23 a day. Okay, very good.
The important message that we want to do is to share perfectly in 2 parts. The first part of day to face the emergency, and the second part of the day, the 12 hours remaining, to imagine how to move to phase 2. So new project, not only to solve the emergency, but to create new solution for what we have to live after.
Very good. Deputy Mayor Fong, 60 seconds. How do you divide your day and how many hours a week would you say you're working, really?
So Richard, how to divide my day is right now it's almost in COVID-19 response around the clock, really. I mean, the initial focus is on sort of our daily metrics and stand-ups around where we are in terms of both community needs, homeless and human services, city operations, and public safety and public health. Those are the 4 buckets of work that we really focus in on every morning to make sure that we have clarity of mission and objective in terms of how we're keeping our community safe and how we're doing what we can to.
How many hours a day? How many hours a week do you work?
I mean, this, as my colleagues on the panel know, the jobs we're in require sort of 24/7 attention, and whenever we get a call, we're up and addressing it. But
you're on it. Okay.
I'd rather focus more on the fact that people across our city are working very hard and together to crisis.
We appreciate all of the frontline workers and heroes all across the country and the world in every respective city that are doing some amazing things. Deputy Mayor Sargadui. How many hours a week would you say? Is it is it 160 hours a week? And how do you divide up your day? 60 seconds, please.
Yeah, I would say that the city and my colleagues will know that very, very well. Takes 24 hours work. Honestly, I have to tell you that since the 28th of February, my day is divided into situations. One of them is when I am at the town hall, which maybe during 16 hours a day. It has been like that for many days, and not only for me, but all the government and all the essential workers have been doing the same. And that time that I spend at home, which doesn't mean that we are not working at it.
Fantastic, fantastic. I want to now. We're going to get to what's next, and Deputy Mayor Parenti brought that up. What is after this first cycle, right? How do you reimagine your cities? And I want to stay on that idea. And if you can, then I'm going to move to the questions and answers. But how do you reimagine and how do you rebuild to get to that point of that reimagining? Again, if you can, 60 seconds. We have about 15 minutes more in our conversation. I want to get to a lot of stuff. So Deputy Mayor Fong, 60 seconds to you. How do you reimagine Seattle? How do you rebuild to get there?
Right, Richard. So I think number one is I think we need to think of the work ahead of us in actually two phases that are sort of concentric circles. One we refer to as reopening, and the other is recovery. I think the reopening context is to build the kind of infrastructure and thinking around how we unwind and start relaxing social distancing in the near term in order to bring our economy back to life, but also the vibrancy that we are so accustomed to here in Seattle. On recovery, longer term, I think there is an opportunity for us to center. Number one is center around equity. I mean, and reflect the values of our community and make sure that as we come out of this, just as we went into it, that we take care of the most vulnerable and those that need the support and assistance that's needed to be able to get back to the feet. So I think we center around equity and we look at the opportunities of what we've learned through these last couple of months. I mean, basic things such as telecommuting and working from home. I mean, frankly, I've gotten so much better using technology like this that maybe we don't need to be in the office every single day, and we can get productive work done through the use of technology and innovation, which is something
when will you start the reopening, Deputy Mayor Fong? Just give me the number of weeks you guess it to be. Of course, everything changes day to day. Would you say a month, 2 weeks?
I think the process of starting reopening is probably underway, but I think it's going to be
right now.
It's going to be a while.
Right now is what you're saying.
Yeah, I mean, so immediately this week, the governor announced sort of returning to some level of construction activity yesterday. Governor Inslee announced some changes to recreational activity in national parks. But so we are beginning that process. But I definitely want to caution that this is a work in progress, and we're gonna be looking to the researchers and public health officials to help us through this. So,
Deputy Mayor Sargadui, please, when do you think you'll move to that next phase, and how do you reimagine, rebuild to get there?
I couldn't dare myself to give you any date, not at all, because as we have already said, we are learning that things change so fast that we can't even imagine that. And secondly, because I think that we have to be very serious about the advices that the health system gives us. When talking about when we are reopening, that I think that the Deputy Mayor Fogg make a very good division among reopening and recovery. That's how I think we are, all of us, looking to the future. I would say that we have to be very conscious that we know what we know. We know about managing the city, but we don't know about health that much. Even being a doctor, as I am myself, that's maybe why I'm so respectful to what our health authorities go advising us. I really hope that we will be able to start in a short term, but I couldn't dare myself, not even for the reopening of the town hall, to give a certain date. Sometimes that makes people expect that things are going to be as they used to be. And that's something that's not going to happen for just a long time.
Very good. Deputy Mayor Peronti, 60 seconds to you. How do you reimagine and how do you rebuild Torino? And unmute yourself if you can for me.
Yes, we have to change the paradigm. So in this emergency period, we show that we can do something considered impossible before. For example, smart working for public administration. Before this emergency, they told me, Marco, it's impossible to put in smart working mode your employee. In this moment, I have more than 50% of our employees in smart working mode. That's the real challenge. This is the real heritage of this period. Also, in the phase 2, I want to improve the smart working mode. That's one example of the important heritage of this emergency phase.
I would like to add to that also the importance of working with data. How important it is to have our data system of the movements of the city, of the ideas of the city, because that will help us to have the information that we need in order to take the next steps and also the decisions.
Very good. Thank you, all three deputy mayors. I'm going to move into the questions and answers right now, which is at the bottom of your screen for those of you who would like to ask a question. I'm just going to read 3 questions, and if the deputy mayors, whoever would like to answer it, just raise your hand and answer it if you can in 30 seconds so we can get through as many as we can. I'll read this question. How are crisis management and the measures taken being communicated to neighbors, maybe other cities that are close by? Another question. In the current debate about opening back up, we are hearing that the virus does not stop at borders. How does the regional cooperation work to ensure that positive results are not jeopardized? Those 2 questions very similar. How are you coordinating with fellow cities? Another question. How many contact tracers do you have? Is there a ratio of a number basically of contact tracers for every 100,000 people? So we really have 2 types of questions there. Who would like to address those? Either one of those.
Yeah, I'll take a stab, Richard. So on the first question, just announced actually today or yesterday, the governors of Colorado and Nevada have joined the Western states and Washington, Oregon, and California in order to really try to, as we move out of the social distancing measures, to approach this in a coordinated and consolidated fashion so that there is some consistency that is rooted in the research and the public health guidance as we work together to move through the challenges of reopening and then ultimately recovery. The second piece on contact tracing, and I'm really glad someone raised this question because we really feel very strongly that there are 2 prerequisites for our ability to be able to sustain disease suppression going forward, given the timeline to get to appropriate vaccination and other measures, and that is testing, widespread testing capacity, and widespread contact tracing. And for us, our state is estimating that we need roughly 1,500 personnel to be able to meet 2 key objectives on contact tracing. One is to be able to, within 24 hours, identify all the individuals that have come into contact with someone that has tested COVID positive. And then within 48 hours to actually make communication with those individuals. And that to us is a key tactical strategy when it comes to our go forward in our ability to manage our way and bridge to the point where we have actual vaccinations. So I don't have the specific not per 100,000 number for you, but gives you an order of magnitude of what it may take for a community our size to be able to have a sufficient contact tracing.
Deputy Mayor Sargadouly, I want to address it. Please do also, you could address those questions, but I wanted to add another element into this. What advice can you give to developing nations with poor health infrastructure like Zimbabwe, for instance? If you could address that question, if you can, plus the others.
Yeah. I was thinking about that question because I saw it on the chat, so I could read it. And it's difficult, it's really difficult to answer, because it's not something that can be done from one day to another one. I think it's something that has to be worked for years, and is absolutely need to invest on the public health service and also in research. It will be the only way that we can learn from what we are suffering and also try to prevent from the future. As I told you at the very beginning of our meeting, I am convinced that if we shouldn't have the very good public health system, I am talking about public, even in now, public and private health system in the Basque Country are working all of them together, but the leadership is from, and has to be, from my point of view, from the public health system. We shouldn't be talking about, we think that we are seeing the light.
Right.
It's essential. Investment on health system and research. About the other questions, I just wanted to talk about communication. We have been using all our social media, the website of the town hall, of course, Twitter, Facebook, all that kind of social media that we are getting so used to. It's true that our population in Bilbao is getting more and more used to have the relation with the town hall using that kind of telematic ways. But even though, something that we have done is we are still calling one by one everybody who is over 65 years old in our city. One by one, asking them whether they are alone, whether they have any need, whether we can help them, and always offering them our help through our phone 10010.
010. Deputy Mayor Peronti, do you also organize home visits? That's one of the questions for those who are confirmed cases. Do you find it effective? And second question for you is, what are the best projects that came out of the Torino City Lab to you, Deputy Mayor Peronti?
Yeah, we are arranging a local visit, not only for healthy problem, but also several type of support for food, for medicine, and so on. So we have a lot of people that can move from their home. So not only the healthy support, but also food and so on. The project, we have a lot of projects in our platform, Torino City Lab. But one important project is to help our students for the lack of connection, internet connection. We create a very quick project with the private telco player to support the student to improve their capacity to manage smart education, because that's our important problem. Another important questions is the local service, what local service were most difficult to manage. The important challenge is a new way to imagine and redesign the public transportation. That's our problem, and we imagine a sort of modularity, public and private transportation, scooters, bicycle, that we have to change our ideas before this emergency.
Really great answers from all the deputy mayors here. Thank you. And Deputy Mayor Fong, 60 seconds to you here. This question saying much of the attention has focused on the response from federal government. Do you feel that your constituents are more aware of what you do on the ground now? Because that's where a lot of the answers are coming from, solutions. Your Department of Public Health in your city is what people are getting to know very closely now.
Yeah, I mean, I think that, I mean, one of the things that we, and I spoke to this earlier, and I think my colleagues on the panel today have also spoken to, which is that at the end of the day, I really believe strongly that the compliance with social distancing measures in a pandemic response is reliant on voluntary compliance, and the unity between different levels of government, that the state, the county level, and the city level being on the same page, speaking with one voice, relying on the facts and the science and the research, carrying out public health guidance, has been really a manifestation ultimately of the trust between public and government.
Deputy Mayor, the question is this, really, to simplify it, is Deputy Mayor Fong, are folks in the streets now saying, "Oh, I know who the mayor is. I know who the deputy mayor is. I now know what the Department of Health is doing." Is an awareness there? Would you say it's higher or lower than before?
I would say that's a great question. I'd say awareness is definitely higher. I would say, though, that it's, again, the dynamics of social distancing and stay-at-home orders is very challenging for the public, and the willingness of the public to stick with us through this has everything to do with the fact that we are rooting our work and effort around what we think is in the best interest of public health, and it is our responsibility to deliver that message and maintain that trust. So I do think there's been and we have to thank the people in our community for sticking with this so long, and we need them to continue to stick with us.
Deputy Mayor Peranti, one of the questions and one of the topics brought up by all three of you is care facilities. Those care facilities, which are so essential. And right now, when we talk about hotspots in the hotspots, we certainly are looking at care facilities. I have a father who is in a care facility, and now a quarter of the residents are testing positive. So are many of the care workers in these situations. It's tough for a lot of folks all around the world as they have their loved ones in these care facilities. One of the questions is asking, what local services were the most difficult to manage? I go back to the Department of Health, or your health leaders in your city, Deputy Mayor Peranti. I gotta imagine this has been very difficult for them to keep up with stuff.
Yes, for us it's very difficult to imagine new need. One of the problems that we have, and to intercept what we call new poor. We have to manage a new part of our citizen that I didn't know before, and I had to create new instrument to support this new part of our citizens. And before creating the solution, we have to understand well the new need, the emerging need of this particular phase.
Perfect. Deputy Mayor Sargadoui, as you are an international city, all of you, all three of you, how has international coordination or relationships that you have factored into the way you've dealt with COVID so far?
Well, I could say that it has been absolutely positive, because from those cities that were ahead in suffering this pandemic isolation, I would say, we have been able to talk to them directly and learn from them. Whenever we have been with any doubt that we needed to be solved, we only had to ask, and they were answering us immediately. There is a second thing also, the support. We have received support from many cities that were part of our international relations. And also we are trying to do the same with all those that are asking us for any kind of support. Also, I would say that we have been working hardly during all these 5 weeks that are the last ones that we are suffering this, in all the international relation or multi-level participation forums, as this one we are taking part now. We have maintained our relations with all the international teams using these new ways of communication that we have been talking about. It has been not only for us as a way of communicating our population, but also the other cities and trying to learn from them.
Fantastic. I have a question here. It reads, COVID-19 outbreak as a stress test, how would you rate the capacity from 1 to 5, I imagine 1 being low, 5 being high, of your city to deal with and recover from this crisis if it were to happen again? 1 to 5, 1 being low, 5 being high in terms of your city, if going forward to handle the crisis. Deputy Mayor Fong, 1 to 5.
To handle the crisis going forward?
Yes,
I would say somewhere between a 3 and a 4, but I want to emphasize this point, which is that the truth be told, the scale and order of magnitude of what cities across the United States and the world have had to deal with are beyond, in many ways, the capability of cities to deal with on their own. I mean, the enormity of the challenge, whether we talk about testing or homelessness, I mean, they are issues that are beyond the control of the city by itself, and that's why it's so critical and important for both the collaboration at the local, state, and regional level, but also international level. As Deputy Mayor Sagardi mentioned, I mean, we have received PPE donations from China and elsewhere as we try to move through this crisis, and it's building on existing relationships that allow those kinds of opportunities to happen.
Deputy Mayor Peronti, 1 to 5 in terms of if you were to face this again, how Torino would do that. 1 to 5, what would you say?
We imagine a sort of a give back platform. So to acquire different expertise, the different experience that we can translate in our particular context. And we imagine a solution that we don't have an idea to do that.
1 to 5, what would you put it though in terms of Torino's capacity going forward to handle something like this again in case there is another cycle, which many guess there is? Just give me a number if you can, Deputy Mayor Peronti.
Sorry?
1 to 5, how would you say Torino is ready in terms of capacity to handle another cycle of COVID?
I hope that is an unreal prospect, but we show that now we are ready to face a new virus, not only a biological virus, but also economic, social virus. That's the important aspect. Our capacity to react of an unexpected phenomena. That's a real heritage of this particular phase.
Thank you. Deputy Mayor Sargadui, from 1 to 5, how would you say Bilbao, 5 being very capable, 1 very incapable, to handle another cycle of COVID, would you say?
Well, I really wouldn't like to imagine that, but if I have to, not taking into account economic recovery, because that's something that we are not facing directly now, and we don't know how it's going to develop. I would say that the capacity of the city trying to go against the pandemic as the one we are living now should be like 4-1.
Very good, very good, very good.
Yeah, I would say that.
I want to thank all 3 of the deputy mayors for joining our discussion today, hosted by the German Marshall Fund. It's been a real pleasure for myself to be part of this conversation as we try to get some of the best practices and real reflections from our deputy mayors here, the practitioners, right? We talk about frontline heroes, that's sort of the term in North America, in the United States, in terms of talking about those who are fighting COVID-19. And these 3 that you see on screen are one of our group of the frontline heroes doing something every day in their respective cities. I want to thank all 3 of you for being here during this discussion as a visiting fellow. It is really a pleasure to talk to all of you. And I want to finish with this. Who has inspired you to work harder and faster and do more? And I'll start with you, Deputy Mayor Sargadou. Who's inspired you throughout this entire fight?
each citizen of the city of Bilbao. I got it very clear when I came into the town hall that I was here as a public server, and that's something that inspires me every week. Every single citizen of the city of Bilbao.
Deputy Mayor Fong.
Richard, I agree with Deputy Mayor Segardi. Dewey, the people of Seattle have been incredible throughout this crisis. I have to give a shout out to our first responders, the people on the front line, the nurses, the medical workers, the people working our homeless shelters, fire and police officers that are out there dealing with the day-to-day impacts and also keeping our communities safe. And then ultimately, I also have been incredibly inspired by Mayor Durkin. I mean, the leadership she has demonstrated throughout this crisis for the city, for the region, and as a voice of really advocating for rooting our actions around science and facts has been how we have, I feel like we have managed our way to this point through this crisis and will continue to do so going forward.
Deputy Mayor Parenti, who has inspired you to get up every day and work those long days?
Yes, the capacity of a public administration to understand the real problem and try to do a very quickly and a real social impact solution for the top and the bottom. All of our employees or our citizens can do it, everyone in their role a contribution to solve together this emergency.
Well, I'll ask myself the same question, who inspires me? And it'd be all three of you. Thank you for your time today, all deputy mayors. Early hotspot cities, we could spend a lot more time. I've already gone over by 10 minutes, but it certainly was because you have so much to offer to all of us and all of those who have joined us across 5 continents to hear from you today. The practitioners, as I've said so many times, thank you for inspiring me and many others, because you're the ones making it all happen, whether it be in Bilbao, Seattle, or in Torino. I look forward to another conversation in the future where all 4 of us can gather along with everybody else on this conversation when it's a sunnier day, right? When we can talk about things together. Thank you, and thank you all for being here.
Thank you very much. Bye. Take care.